where to find this information for the people who trust you to know the answers. Now, we can't know everything, especially and even as CSA graduates. What we can do is know enough to guide our customers. So this will be a good way for you to reconnect by giving updated information to your colleagues and your customers. And remember, you're probably not an expert in any or all of these topics, and don't try to be. You probably have enough information to be dangerous, but you will have the resources that you can check to find out what these limits are and how they apply to your client's particular situation. You're seeking information that they may need, but you should give a disclaimer and refer them to specialists about each of these topics. So let's talk about changes in Social Security. And of course, you know Social Security provides the American family with a package of disability, retirement, and survivors protection, and it's the largest source of income for seniors. Do you realize that when Social Security income for retirement was a new idea back in the 30s, we weren't ever expected to collect because we were not expected to live much past 65. Wow, have things ever changed? Now, who knew? I mean, here is our former president, Roosevelt, and he says we can't insure everything, 100% of the population against 100% of the hazards of life, but we've tried to frame a law which will give some measure of protection to the average citizen and to his family against poverty-ridden old age. And that was in 1935 when Social Security was introduced. Now here, who knew this? 6 generations. Think about some families you know that they say, well, my mom or my grandma is still going strong. She's over 100 years old. Well, her son is 85. His son is 65. This is just an example. They all draw Social Security retirement benefits, and they also draw Medicare. Now, what if his daughter, 45, is disabled, and she's on Social Security disability income? There's 4 on a program that was supposed to support maybe 30% of the population who even lived past 65. And then her son is 25 and barely paying any taxes in to support all of these people above. And then his new baby daughter makes the 6th generation. And I literally have met people who are the 6th generation or 5th with a new baby. So who could have guessed? So when we talk about what has happened to Social Security, we need to realize that this many people were not expected to collect the retirement benefits all at the same time, or disability. So Medicare suffers with the exact same dilemma. These programs were developed through 1956. So first we started with retirement insurance, then survivors insurance, and then disability income insurance. The government realized we wouldn't be able to sustain ourselves without help before and after we retire. Now, the full retirement benefits, that's when you reach your age that you can collect the maximum should you have paid in at least 10 years worth of taxes into Social Security. Full retirement age once was 65. Now it's as late as 66 in several months. It's probably going to be 67 for some of you coming up. So the retirement age varies based on your year of birth. And there are increased benefits for retirement after you could have claimed at your full retirement age. So if you even waited till 70, you'd get more than the maximum of what you could get at 65, 66, 67. Some people take reduced benefits at 62 as long as they've paid in at least 40 credits, which used to be called 40 quarters of taxes into Social Security from your work. But if you take the reduced benefits at 62, those won't catch up as you get to be your full retirement age. You'll settle on what that is. And then the Medicare eligibility still remains at 65, even though these full retirement dates are fluctuating based on your year of birth. You can work and still receive benefits. So this is the oh shoot, I should have changed that to 2012, I'm sorry. So under your full retirement age, you can still be working. It's just that you couldn't have more than $14,640 per year or $1,220 per month, or you will have some deductions taken out of your Social Security. So some people who go ahead and file at 62, they're working and earning too much money to even get anything because they're over that limit. So if it's even higher than that $14,000, you may not receive anything, but at least you're in the system and could then start collecting when you reach your full retirement age or you stop working so much and earning so much. In the year when the worker reaches the full retirement age, it's $38,880 in those first months until retirement months, and then it's so if you were earning at least $3,240 a month, that would be just until your birth month. Then you'd have, for every $3 you earned over this amount, $1 would be withheld from your Social Security. When you reach full retirement age, there's no limit on how much you can earn, and so there's nothing that is withheld. And of course, this year, the full benefits for Social Security at your full retirement age, should you have worked at least those 10 years or 40 credits of work paid in your taxes, it would be a full benefit of $2,513 a month. Of course, it's based on 35 years of your highest earnings. So if you didn't have a lot of earnings, you may not get that full amount, but at least you would have access to that if you meet all of the requirements that Social Security allows you to meet. Now, you can go to Medicare.gov to get these limits and to learn more. So there's your first resource if you needed to check on something or help one of your clients to navigate through what their benefits would be. Everyone receives, over age 25, everyone receives just before their birthday month their Social Security statement if they are working and paying into Social Security. That's perhaps a date that you might want to get back to your customers, is when they get that letter, and refer to that and review it with them so that you can be a resource to guide them through exactly what their Social Security benefits are lined up to be. It's always a nice way to reconnect with them before their birthday. So due to an increase in Social Security income, retirement income of 3.6% this year, these are the average benefits that are being paid out. So you can see the average. Now, we talked about in the last slide, the maximum is over $2,000, but the average of all retired workers of what they are drawing is about $1,229 per person per month. A couple is higher. A widowed mother with 2 children, you can see they're even higher. A widow or widower, the average is even lower than what the couple was getting. Disabled worker, spouse, and if 1 or more children, and then all disabled workers on average. This isn't the actual, it's on average of what they're collecting this year. So when you think about that, is this a way to sustain a lifestyle that's been used to much more income? Probably not. I mean, things are going to need to change. Lifestyles will need to change based on this income. And hopefully there's savings or other retirement investments or 401ks that can supplement this. There's your source, Medicare.gov. The last couple of years, we haven't had any increase in Social Security benefits, so this is good news this year, trying to keep up with inflation. So let's talk about changes in Medicare now. So we talked about Social Security. Let's go to the next government program, and Medicare, of course, is health insurance. It's an entitlement program, which means that you do have a happy birthday present at age 65 of Medicare. You may not want to take it at 65 if you're already working and you have another benefit that is health insurance. But if you wanted to use both, as one would be your health insurance from your work would be primary, Medicare would be secondary. But some people go on Medicare exclusively. So Part A is hospitalization. That has some copays or at least deductibles. Part B is copays and premium, and I'll show you those. That's the physician's therapist outpatient. Part C is a package plan like United Health or Humana or Kaiser, depends on where you live. It'd be a package plan of Parts A and B and probably add on prescription drug coverage to that. And Part D is your prescription coverage, and Medicare supplement then pays the out-of-pocket costs of deductibles and copays. So in 1965, when Medicare was started, people could either no longer afford their health insurance, maybe weren't offered it at work, or maybe they were still working and they switched to the government-run program to save money. Maybe they didn't even have their own insurance, or now would be covered by the government. Today, when we think about this, we have to think about what does Medicare cover. It is not a complete, full, 100% coverage of everything. So you may want to hang on to the health insurance that is available through work, at least as long as possible. So on Part A, that's the hospitalization, and this year the monthly premium is usually zero if you've paid in enough in your Social Security taxes through your work, or if you haven't, then it could be adjusted all the way up to $451 as the maximum per month for someone who had not paid in any Social Security taxes and wanted to buy this Part A hospitalization. Based on the taxes you paid to Social Security through your FICA taxes while you were working. There is a deductible per benefit period, and a benefit period is normally 60 days if you were admitted to a hospital and then you had care under Medicare, and then it restarts again after you've passed 60 days. So the $1,156 deductible could be paid more times in 1 year than just once a year. Also, Part A pays for up to 100 days in a skilled nursing facility or rehab facility for recovery, as long as it's a Medicare-approved facility. And so days 1 through 20 are paid in full by Medicare, and then in days 21 to 100, the resident of that facility would pay at least $144.50 per day copay. That might be covered by a Medicare supplement. It could be covered by other insurances, but this would be a person who possibly doesn't have anything else other than Medicare. So there are out-of-pocket costs. It's not free, and I think a lot of seniors going into their 65th birthday think, no, well, I'll just switch to Medicare. It's going to be great. So there are hospitalization copays, and if you stay longer, and there are, of course, these copays and the premium. The monthly premium, if you did have to pay something, which you probably wouldn't, would be paid to Medicare to have your coverage. Part B is physicians, therapists, outpatient services. This is not free. There's a basic monthly Medicare B premium in 2012, and it's $99.90. This is up a little bit from 2011 for those who were already enrolled on the program. Those who came in 2010 paid monthly premiums of $110.50, even higher. And this year, for new enrollees, it's $115.40 per month for, it was $150.40 per month for last year. So just see, it's down a little bit, and that's really good news for seniors, obviously, if they're on a fixed income. The Medicare beneficiary can be billed, or this amount can be deducted from their Social Security checks to make it very easy to pay these premiums. So if you have Part A, you don't have enough. If you have Part B, you may still not have enough coverage because it does not include prescription drug coverage. And you would want to have, in addition to this, a Medicare supplement that would pay these out-of-pocket costs. On Medicare Part B, too, is the MAGI is it's a figure that you would need to pay for your premium if you had higher incomes. So for joint filers in 2012, the Part B premium would be higher if you had $85,000 to $107,000. That would be in your income, and higher up to $214,000 if you are a joint filer with a spouse. Then you can see your monthly Part B premium would be $139.90, up from the lower amount below $100. As you earn more money, or you're in that higher income bracket, you do have more to pay in your Part B premium. So I just wanted to let you know that it isn't just a fixed amount. It is based on your income. So the people who were at the lower amount were up to $85,000 in income. And then also the annual deductible for 2012 for Part B is $140. Remember that annual premium is different than Medicare. Medicare, you have a deductible based on your benefit periods and how many times you pass those. So this is just an annual, and it is actually down from last year. These are some of the good news things this year. You can always go to Medicare.gov, SocialSecurity.gov to get all of these kinds of information. Now, Medicare Part C is a packaged plan, and that just means that the provider, who's usually a network of doctors and professionals, and those providers then handle the A and B. You have to be enrolled in them, but they handle any relationship between you and A and B. And they can include prescription drug coverage, and you don't need a Medicare supplement because your deductibles and copays will be covered by this package plan. Some people go into a package plan like this because they don't want to be managing everything themselves. They like their doctors. They happen to be included in that plan. You would have to switch to those doctors if your doctor did not take Part C. But the premium can be zero, or it could be a monthly amount depending on the plan and what you choose. Think about having this package plan with most everything included, and just remember that the government is paying the provider an amount and from the A and B coverage, and you may have more in deductibles or copays. Depends on the plan, how it's set up. It's a privatized way of providing the Medicare. But these plans can also add on dental, vision, and foot care for more costs. So let's say you were leaving your employer, you were changing over to Medicare, so you consequently lost dental, vision, or foot care, and you wanted to pick that up. It may be more beneficial for you to pick it up in a package plan like this. And then there are even seniors benefits in these prepackaged plans of exercising in a gym or going to curves. They want to do a lot with their seniors on these plans to do preventative things to keep them more healthy. Part D is prescription drug coverage, and you can include it in a package plan in Part C, or you can pay for it yourself. This year there's an initial deductible, and it increases to $320, which is the initial deductible, and that's in 2012. And then there's an initial coverage limit. That increases to $2,930 in 2012. So this coverage limit would be paid for once you had paid your deductible. However, then you have an out-of-pocket threshold that goes to $4,700 in 2012. And so remember the donut hole. Let's talk a little bit about how that works, because there is more out-of-pocket with this than you might think. So let's go over the coverage gap. It begins once you reach your Medicare Part D plan's initial coverage limit. In 2012 was $2,930. So what happened, let me just flip back here. You have $2,930 in that initial coverage limit after you've paid your deductible. And then Part D enrollees will continue to receive a 50% discount on total cost of brand name drugs while in that donut hole, up to $4,700 in 2012. So you're spending quite a bit out of pocket beyond that $2,930 up to $4,700. So you're in the donut hole, and that there are full retail costs of the drugs still apply to getting out of the donut hole, even though 50% was paid for by the pharmaceutical manufacturers. Enrollees will pay a maximum of 86% copay on generic drugs while in that donut hole, the coverage gap. Then there's a cost sharing in the catastrophic coverage portion of the benefit. It'll increase to the greater of 5% or $2.60 for generic or preferred drugs. That's a multi-source drug, and the greater of $6.50 for all other drugs this year. So the maximum copayments below the out-of-pocket threshold for certain low-income, full-subsidy eligible enrollees will increase also. So just wanted to give that to you. You may want to go to Medicare.gov, look up Part D to get even a more in-depth description of how this all works. But it originally was intended to help us with folks who have a lot of out-of-pocket costs for drugs, and this at least gives them some stopgap. But for people who don't have a lot of out-of-pocket costs for drugs, you're going to be paying quite a bit on your own. Now the next one is Medicare supplement insurance, and I think people get confused about this. They think this is covering doctors and rehab, all the other kinds of therapies, or skilled nursing coverage. It's not covering the kinds of providers that you need care from. What this is doing is helping you to cover the out-of-pocket costs, so you won't have as much out-of-pocket costs. So it pays those deductibles and co-pays that are on that, Part A, Part B, Part D. And the premium on this is based on the plan that is chosen. So there are a number of plans that you can choose from, and you will definitely need a professional insurance agent who does sell Medicare supplement insurance to help you with this. Very often those folks still sell Part C or Part D, but buying Medicare supplement insurance is really important if you don't have the Part C packaged plan. So let's take a look at how these plans are described. If you take Part A, Part B, Part C, and Part D coverage under Medicare, you need a Medicare supplement insurance plan to cover your out-of-pocket costs. However, the Part C includes it, so you don't have to pay an extra premium. Now, Plan A in these, now don't think about this as Plan A for Medicare. These are the plans that are available, 5 plans that are available under Medicare supplement insurance. Plan A is for basic benefits of hospitalization, hospice care, and Part B co-insurance. It's going to help you pay the out-of-pocket costs. Part B adds on the Part A deductible coverage. Plan F is the most comprehensive and most popular. It adds skilled nursing facility co-insurance, foreign travel emergency care, Part B excess charges, and Part B deductibles. Part G does not include the Part B deductibles, so now we're starting to take things away. And Plan N requires co-payments for office visits and emergency room visits that the others don't, and it does not include Part B excess charges or Part B deductible. So people, when we explain this to someone who's looking for this type of insurance, they're usually zeroing in, and we recommend Plan F because it's the most comprehensive, and you should not have as much out of your pocket to help cover what Medicare does not cover, or the deductibles and co-pays. I know I'm going through this pretty fast, but all of this you can see at Medicare.gov online. There's also a Medicare and You for 2012. It's a booklet that you can order at that website, and sometimes good to have in your hands. So it's called Medicare and You, and it's for 2012, and it really describes all of this to you too. Now the next one is talking about changes in Medicaid. So when Medicare was created to help us with health insurance for over age 65 and up, then Medicaid was designed at the same time in 1965, and that's for prenatal, maternity, all the way through children and young adults and seniors and adults and seniors who don't have enough money to buy their own health insurance. So they don't have the money for these out-of-pocket costs or these premiums. So let's talk about changes in Medicaid this year. It was created in '65 under Title 19 of the Social Security Act. You've been paying into helping support Medicaid through your FICA taxes. It's jointly funded, so it's a cooperative venture between federal and state governments. It's controlled at the state level, so each state could have a very different Medicaid program than the states surrounding it or other states in the U.S. It's a health care insurance. It's a safety net for those with low incomes, low assets. So you do have to qualify. It's not an entitlement program. So what we call it is means tested. It's available to those who, regardless of age, meet state medical and financial eligibility. It pays medical costs when the individual cannot. So it's not an entitlement, happy birthday at 65. This is a tested program based on income and assets. You can go to Medicaid.gov to get this information too. So Medicaid and the CHIP program provide health coverage to children all the way through seniors to nearly 60 million Americans. The biggest draw off of this program is for seniors. And of course, with us living longer, these programs in some states are in dire straits. They just don't have any new money coming into them to support their indigent population. So it's health insurance, and it provides it to more than 4.6 million low-income seniors, and many are also on Medicare. And then Medicaid also covers additional services beyond those provided under Medicare. So it includes nursing facility care beyond the 100-day limit. So when people ask me, does Medicaid pay for long-term care? Yes, it does. Does Medicare pay for long-term care? No, it just pays that skilled care up to those 100 days if you qualify. It also pays for prescription drugs, eyeglasses, hearing aids. Services covered by both programs are first paid by Medicare, with Medicaid filling in the difference up to the state's payment limits. So let's look at some of those things here. Medicaid is the largest payer of long-term care, with almost 50% of nursing home costs are under this program. So you might be thinking, well, my clients don't want to talk about Medicaid. Well, I will tell you, having been a nursing home administrator for over 15 years, the folks who were in the Medicaid beds in my facilities didn't want to be there, and also didn't think they would ever get to there. Even if they didn't have much money, they thought maybe their family would take care of them. So it's really a last resort, but I'm so grateful that it's there, that we are paying in money out of our working taxes to support folks who can't take care of themselves. So this information that I gathered for you today is from LTC Georgetown .edu. So it's www.ltcgeorgetown.edu if you are not following my slides. And then, of course, the annual limits are covered under the Medicaid.gov or CMS.gov on the web. Income and assets are counted for someone who's going on to long-term care for Medicaid, and they are counted to qualify. So all assets of a couple are counted together, and only the income for the person applying for Medicaid is considered. So the spouse in the house is what I call them, the community spouse, who doesn't need the Medicaid, does not have to put their income toward the person's income going to the nursing home to take care of them under Medicaid. There's a home equity limit that's $500,000 in some states, up to $750,000 in other states, depending on that state's equity limit. So if you had a home that was at least that much in equity, you wouldn't qualify for long-term care. If you were a single person, you'd have to sell that home and use that money first. If you're a couple, of course, the person staying, I call them the house spouse, the person staying in the house is protected there, and the house is not taken away until and if that person leaves or sells the home. So you could have more in an equity limit above these amounts or equal to these amounts if you were a couple, but a lien would be placed on the home to pay Medicaid back when that home is sold. The asset limit for the person going on to Medicaid is $2,000 to $4,000 this year, depending on the state, and it is for the spouse staying in the house. They could keep out of the assets, the combined assets, up to $113,640, and that would be for a spouse, a disabled adult, a person under 21 staying in the house until that house is sold. So you've been living off of maybe $800,000. The one person going into the nursing home or on Medicaid needs to spend their portion down to $2,000, and the spouse could keep over $100,000 for maintaining the home, paying the bills, taxes. What a lifestyle change they would have because of the reduction in income. Some states limit the amount of income for the beneficiary, so we're going to talk about that. And of course, here is where we are limiting the amount of assets that are available to both of them. The minimum monthly maintenance needs allowance is for the spouse to keep their normal lifestyle, and that's a maximum of income of $2,739 in 2012. Some states only allow the minimum for that person in the house to keep for income. But I tell you what, if someone had more than that, that's okay. If they have less than that, then some of the beneficiary of Medicaid who is going on that program, some of their income could be diverted over to bring this spouse up to these minimums or maximums. You can look this up on Medicaid.gov, and I also received this information from the Kaiser Family Foundation and the Medicaid Manual, and you can see you can go to MedicaidManual.com. Now talking about long-term care insurance, why do people buy long-term care insurance, maybe even if they think they are not having much in assets or income and they need to possibly have care? Well, long-term care insurance allows you to stay home longer, and possibly Medicaid would supplement that under the home and community-based program to let you stay at home and receive care from people you know and trust. But normally people are going to a Medicaid nursing home, and so they could apply a long-term care insurance policy toward their care along with Medicaid in a nursing home, possibly have more choices of where they're going to be going if that happens, or use their long-term care insurance policy first at the nursing home before they go on to the government program of Medicaid. So buying long-term care insurance is usually for the mid to upper income and upper assets folks, but some people with even only $200,000 or in their assets and maybe a lower income, but they can have their family pay for long-term care insurance. There are some tax incentives to do so. So an individual taxpayer who itemizes their deductions can use an eligible premium amount each year to get a deduction on federal income tax. And some states also have a deduction or credit based on the income or the assets of the person who has a long-term care insurance policy. You can go to online and you can Google what each state has. Also, you can look at this tax code to see in your state what it would be. So the eligible long-term care insurance premium in 2012 that you should put on your taxes or give to your tax preparer is if you reach a certain age, this is how much it's going to be as a deduction on your federal income tax, but you must, of course, reach the 7.5% threshold of adjusted gross income if you are going to be deducting this. So check with your tax person, but for example, I was talking to somebody yesterday and they're 63 years old. Their long-term care insurance premium is $4,000 a year. They'll be able to deduct $3,500 if they add their premium, this eligible amount, to all of their other non-reimbursed medical expenses. This is a medical expense, this premium. It may, if it's above 7.5%, that total is above 7.5% of their adjusted gross income, they'll be able to take this deduction. So you can look it up on the IRS code if you wish. This amount changes annually, so it's good to look this up each year. Now there's a new partnership in the last 3-4 years under Medicaid, and through the partnership program with long-term care insurance, states promote the purchase of private long-term care insurance by offering consumers access to Medicaid under the special eligibility rules should additional long-term care coverage be needed. So I'll give you an example on the next slide. So Medicaid has, in our state, and with the majority of states, there's over 40 now that offer this partnership. It's a partnership between Medicaid in that state and an insurance company selling long-term care insurance. And if a person buys a long-term care insurance partnership qualified policy, then Medicaid will allow them, when they exhaust their policy or use quite a bit of their benefits out of the long-term care insurance policy, the state will allow them to protect assets before they go on Medicaid. Or even if they go on Medicaid, they don't have to spend all the way down to $2,000 or $4,000 in that state. So let me show you. A long-term care insurance partnership qualified policy has $600,000 of benefits, and the policyholder is on claim and has used some or all of the benefits but still needs care. The state Medicaid department has an agreement with that insurance carrier to protect the same amount, dollar for dollar, that the person used in their policy, and then they don't have to count that toward Medicaid spend down to that $2,000 in the back pocket. If all $600,000 was used for care, then $600,000 was protected in assets, and the person literally could go on to Medicaid. But the intent of these states having these partnerships is that a person doesn't go on Medicaid and continues to use his protected assets to pay for his care. And there's more information on this at the nationalclearinghouse.org. It's the LTC nationalclearinghouse.org. Or you can check with insurance carriers to see if they have the partnership plans or the Department of Insurance. But we're recommending that people do protect assets. Even though you think you will never go on to Medicaid, protecting assets through a partnership is really the way to go, because you're going to protect your own assets and maybe continue to use them and not have to use the Medicaid program. The states are very worried about their Medicaid programs, and they need to keep them for the truly poor. So, ending with your CSA responsibility, keeping up with changes in the senior industry, I think it's important that you continuously learn like you are today. Always plug into the kinds of things that CSA offers to you and keep up with changes in what's going on in your particular industry. Be the advisor you say you are. If you say that you can get this information, now you have some resources to do that. It will just elevate you and provide added value to what you offer to your clients and customers. And then look up these annual limits and changes each January. I normally do this update for you, and you will have access to these slides on the website. So I know Erica will be talking a little bit more about that. But you always have these archived, and you're able to get a hold of these so that you'll know exactly what was said and you can remind yourself. So I do encourage you to always stay up in the industry.